In today's health alert, the CDC estimates that the COVID-19 variant JN.1 is now the fastest growing variant in the U.S. and has become the dominant strain in the Northeast. Our chief health editor, Dr. Partha Nande, joins us with more details. Good afternoon, Doc. Good to see you.
No, thanks, Linda. I appreciate it.
So we know cases are rising quickly. How fast?
Yeah, and I'm coming to you from the hospital, and there's so many people now are talking about having COVID. According to recent CDC data, Glenda, JN.1 is causing more than 1 in 5 COVID infections across the U.S. However, the Northeast is responsible for a third of the new cases. JN.1 is the offspring of BA.2.86, the variant that really caused so much concern this past summer due to the 35 mutations on the spike protein. That's important. Now, the numbers are starting to go up even more, and it was rising this fall. Between late November and mid-December, Glenda, the number of cases of JN.1 doubled here in the U.S., and this was most certainly influenced by a bunch of people giving holiday travel and lower immunity. And we talked about this, only 18% of adults have received the latest COVID booster shot. That's unfortunate because now we're seeing what? A rise in hospitalizations. That's what happens. The CDC said that COVID-related hospitalizations have risen 51% in just the last month, in the last 4 weeks.
So are the symptoms of JN.1 the same as the other variants? And do we expect a vaccine to provide good immunity?
So first of all, the symptoms of JN.1 really like what we've seen with other strains, which is what? Fever, cough, sore throat, getting tired and fatigued, nausea, headache, muscle or body aches, congestion, runny nose, and a new loss of taste and smell. As for the vaccine, your question is important. And immunity, the World Health Organization said that the JN.1, its genetic features may give it an advantage when it comes to evading, right? Evading immunity, meaning escaping our immunity. Early testing suggests the vaccine antibodies may not work as well against this variant, which is not good. And that could be why we're seeing cases rapidly increasing in many parts of the world. Even in countries with high vaccination rates, like the UK and Singapore, there's been a big jump in hospitalization since JN.1 became dominant. Having said that, the CDC and the World Health Organization still expect the latest shot to be effective and increase protection against JN.1. Both these agencies, and I do the same thing, I recommend it as well, not just keeping up to date in the COVID vaccines, but to wear a medical grade face mask in busy places. And remember, just wash your hands, do things that are practical. With the holidays really upon us, we're seeing more friends and family, people around us, more than usual, and gives the virus an opportunity to spread. So if you experience any cold-like symptoms, you feel like you have a cold, please get a COVID test and get tested. Stay home if it's positive so you don't spread it. And please consider getting vaccinated like I did if you're eligible. And the key is that we don't want to spread this to people also who are, immune compromised, the elderly, and then we're going to have deaths that are going to increase, not just hospitalizations. So we'll keep a close eye on this and see what's going to happen in the near future.
Yeah, and we're armed with old methods, right? Hand washing, masking, whatever you need to do.
Exactly. And take it seriously. People are just blowing this off. My sense, and this is not science, this is just listening to patients and some people that are around, even some colleagues, they're just like, it's COVID. Agreed, you shouldn't panic, but you should take it seriously and protect the people around you, especially those that are vulnerable that can die from this. We got to take it seriously.
All right, Doc, thank you so much. Thank
My
you.
pleasure.
We'll see you soon. If you have a health question for the good doctor, you can email him, Dr. Nande at AskDrNande.com, or send it to us on Facebook or Twitter. We'll get it right to him.